Hi, darlings. Today with me is Dr. Isa, who is my brave patient. One of the, let's say, more difficult ones because doctors are the worst patients, but don't tell Dr. Isa that. Anyway, getting back to Dr. Isa. Today we will be performing volumetry, which is a procedure using hyaluronic acid in the area of the cheekbones, cheeks, and chin. All of this is to take some of the weight off the lower part of the face to shape and contour the upper part so that the profile looks a bit lighter and contours more nicely. Do you have any questions? If you do, let me know in the comments, and if not, keep watching because I'll be showing you step by step how the procedure looks. Hi, I'm Isa. I'm an aesthetic medicine doctor. I'm 30 years old and today I'll be having procedures done. I decided to get cheek and chin volumetry because, let's say, it's been a bit of an issue for me for years, if I can even call it that. And honestly, before I got into the world of aesthetic medicine, I didn't really know how to change certain facial features in a way that would look natural, but also just make my face look better. What I would like to achieve above all is to reduce the heaviness in the lower part of my face, to emphasize the jawline more so that my face looks slimmer and so that my cheeks aren't so flat. This isn't my first experience with hyaluronic acid. This is already one of several times I've had contact with hyaluronic acid, and as you can see, my face still looks normal. My only concern is that, contrary to appearances, when it comes to my patients, needles are my friend. But when it comes to me as a patient, they are definitely not. I have experience with other aesthetic procedures. I'm a huge fan of botulinum toxin. Was there a particular moment? Spring came, summer is approaching, and I thought it would just look nice and that I would feel better because of it. Because that's really what aesthetic medicine procedures are all about above all. I was literally forcing myself to drink water, which we often forget to do, even us doctors. Above all, I got enough sleep and I have a positive attitude. I would say the proportions of my face are good. They're not perfect, but in the past, facial asymmetry used to really bother me. That's why I always posed for photos from my left side. I still have that in the back of my mind, but as I get older, I avoid it less, which is a plus. And as for the proportions in general, like I said, they're fine. Honestly, there's nothing about my appearance that I'd like to change. I just want to refresh my look a bit and maybe turn back the clock a little on the things that change over the years. For me, a natural effect is one that doesn't disrupt the proportions of the face, doesn't make others see us as different people, and most importantly, when we feel good about ourselves. Excess in aesthetics is something we see every day on our streets. Am I afraid of going overboard? With my patients, I'm not afraid of it, but when it comes to myself, I think I still maintain that common sense, which I hope will stay with me throughout my career. Lifting and facial contouring often go hand in hand, and I would even say always. But you also have to carefully choose the right product and the most suitable injection sites, so I think that here, in this particular situation, lifting is more of an additional final effect. My chin and cheeks were a bit too flat for me before the procedure, and I always felt they lacked the volume and contour I wanted. That is, my chin isn't very prominent, simply because that's my anatomy and my cheeks are too flat. Before the procedure, I feel a little bit stressed, but also excited, though it's a very positive feeling. It's definitely not the kind of stress you feel before medical school exams. I think that appearance affects my mood, but my mood is really the result of many different things in life. Appearance is maybe 20% of how I feel on a daily basis. Appearance always affects self-confidence. And here I can personally say that I've never really had any major insecurities about my appearance, so maybe it's just easier for me to talk about it, but you could say that's how it is. Today I'm more nervous because I'm on the other side. When a patient is hesitant, I always try to explain everything in a way that doesn't push them toward the procedure, but rather so that the patient knows for themselves. And I do this by talking a lot with the patient and explaining things, and only then do we come to a decision together, whether yes or no. And for example, in my case, when talking with Monica, we also considered different procedures, and together we reached a mutual conclusion. So in my opinion, that's the most important thing. It's easier to be a doctor. Since I've already had aesthetic medicine procedures done, including, as I mentioned, treatments with hyaluronic acid, I take into account that the result might not be perfect, but I also consider other factors that absolutely don't depend on the practitioner or the day, but simply other factors that, for example, we have no control over. I have absolutely no problem with the procedure being recorded because I've liked the camera since I was a child. There are a lot of things I would like viewers to remember from this film. Above all, that there's no need to be afraid of hyaluronic acid treatments, that aesthetic medicine procedures are not just about unnatural results, and that you can be an aesthetic medicine doctor and look good. Maybe, well, certainly this won't break the stereotype that aesthetic medicine treatments don't hurt, because they do hurt. If someone has a low pain threshold like I do, then it just hurts, but the results make up for it. As for the amount of hyaluronic acid injected during my facial volumetry, it was 1 milliliter for the cheekbone arch, meaning half a milliliter here and half a milliliter here. As for the chin, that was a full 1 milliliter. As for the neck, a different hyaluronic acid was used here and 2 milliliters were injected. Physically, after the procedure, I feel very good. During the procedure, I only felt discomfort around the left side. Nothing really surprised me when it comes to facial volumetry, but as for the neck, the whole procedure was new to me, since it was my first treatment on the neck. The procedure met my expectations, both in terms of how it was performed and the results afterward. An unpleasant symptom, or maybe more of a strange one, is that now I have numbness around my cheekbones, my chin, which I feel the most, and a bit on my neck, which feels kind of odd. I really like the visual effect. The biggest change is in the projection of the cheek, both at rest and when I smile, and the side projection of the chin. I achieved exactly the intended result. The effect is very natural, and I think that many people around me, whether they see me very often or not so often, wouldn't notice any difference. I consider the proportions of my face after the procedure to be better, just a bit improved compared to the good ones I mentioned at the beginning. As for the post-procedure recommendations, I know that I will still make sure, for example, not to sleep on one side tonight, and definitely not to use any makeup today, and to take care of the injection sites in terms of general hygiene. And basically, when it comes to volumetry, for example, I shouldn't get a Kobido massage in the near future. I definitely won't be able to go to the gym, swimming pool, or sauna today either, and for the next 2 or 3 days as well. After such an experience, I would tell the patient that I have had this procedure done myself, and that, as you can see, you can achieve natural results with it. There's nothing to be afraid of when it comes to pain or discomfort. The procedure itself also isn't very long in terms of duration, and it doesn't prevent us from functioning normally in our daily lives, like going to work or just going out on the street. The hyaluronic acid used, as far as the face is concerned, was supposed to have a filling effect, and that's exactly what happened. The acid used was intended for volumetry, while the acid applied to the neck was a type specifically for revitalization. I want viewers to remember from this recording that you can achieve natural results with a small amount of product. Speaking as both a patient and a doctor after the procedure, I'd like to say that aesthetic medicine makes sense if we maintain proper intervals between treatments. So, for example, if the acid was administered last year, I know that it's a good idea to have it done again this year. Hi dear ones, once again. As you saw, we expanded the treatment area a bit, the area of action. We performed not only volumetry but also a stimulating treatment on the skin of the neck. We didn't talk much about that today, so I strongly encourage you to go ahead right now and click on the video where I talk about stimulating collagen production, because thanks to that, we'll have better, firmer and stronger skin. And if you enjoyed today's video, let us know in the comments. That way, YouTube will know you liked it and our video will reach a wider audience. Thanks so much for today. Take care. Kisses.